Hi, I'm Dr. Langley. I'm with Pine Ridge Family Medicine here in beautiful Colorado Springs. Sorry, my hair is kind of wet this morning. It looks kind of funny in the video. Hope it doesn't bother you. I ran 7 miles this morning. I've been running more than I ever have before this summer, so that's pretty exciting that I'm actually getting in some distance running, which I've never been good at or liked before, but suddenly I do. Cool thing about getting older, you get to find new things that you enjoy. But anyway, didn't have time to wash my hair or to let my hair dry after my shower this morning, and I ran into work, and here I am. And I wanted to talk to you today about spirometry. So it's one of the hardest tests that we do here in primary care. Specialists also do it, allergists do it, and pulmonologists do it. But it's tricky to do. There's a lot in learning how to do it. It's definitely a learned skill. So I hope that by talking about it with you here, you can get an idea of what it's going to be like if you're going in for spirometry with your doctor soon. And you will have less of a learning curve, that you'll get it faster if you've seen it before, you've thought about it, and you've kind of prepared for what it's going to be like. It's not a painful process, but it is hard. It's not an easy test to do. So what is spirometry? So it's a test to see some aspects of your lungs, how they're working. Typically, it's best for showing whether you have an obstructive pulmonary disease. So asthma or COPD, chronic obstructive pulmonary disease, are by far the most common obstructive lung diseases that I'm evaluating for in the primary care setting. So that's mostly what I'm doing for, is A, seeing if you have it, and B, seeing if you have it and you're on a certain regimen of medications, if it's well controlled and your lung volumes and lung function are back to normal. So I get all sorts of numbers and reports based on the spirometry that you do. And there's a couple numbers that are my key numbers. I'm not a pulmonologist, so I really just narrow it down to the 2 numbers that matter most to me. And if there's something concerning, that's when I send it on to pulmonology, because they are the experts in lung function. So what it is you have to breathe through a little machine. We have a little handheld one that we use here at Pine Ridge. There's also big ones that you set up and calibrate in a really cool way. And I'm not an expert on which ones are best, but I kind of feel like having one is better than having nothing at all, for at least finding out if this could be what's going on, if this could be the cause of shortness of breath or cough or what other symptoms my patients might be having. So first of all, you'll go in, and it's important. This little machine has lots of algorithms for what the normal lung functions and lung capacities are for different people. And it varies depending on age. And race is actually a big one too. I don't really understand all the details of that, but race has a big factor, and your height has a big factor. Your weight will enter as well. It's not quite as big of a factor. It's a limited machine. It only, let's see, the races that I'm typing in right now, it has African, Caucasian, Hispanic, Asian, and other. Definitely not perfect. Maybe better than nothing. I don't really understand the details of whether algorithms are better for this or that. So if you're somewhere between those, I'm sorry, we have to just pick one. So then, let's see, but check my gender. I already typed in my height and weight and age. And then smoker, former smoker, or non-smoker. Cool. And whether we know whether I have asthma or not. As far as I know, I don't have asthma, and I have done this before. So other things to get the best possible test, you need to avoid smoking if you are a smoker for at least 1 hour prior to getting spirometry done. You need to avoid alcohol for 4 hours before you do spirometry. Avoid vigorous exercise for 30 minutes prior to your spirometry. You don't want to already be worn out. Avoid large meals for 2 hours before, and try to avoid other things that might get in the way. Like if you have dentures, make sure they're really well fit in there, because you're going to be blowing out. You don't want those to be distracting you, putting your tongue up to the roof of your mouth to hold them in place. I could imagine braces or a retainer being similar. Unfortunately, I don't have a nose clip today to show you, but that's ideal, is to have a nose clip in place while you're doing this so no air gets out through your nose. You want all the air to rush through this little tube so that the machine can measure it. And then when you're breathing back in, you want it to be measured as well. Okay, so let's see, other things that I want to talk about before we get into what this actually looks like. Great, so when you do it, seated or standing doesn't really matter. You don't want to hunch over as you're doing this because that's going to actually crumple up your lungs. You want to try to sit up, put your head up. You're trying to get as much air out as fast as possible. That first second of air coming out is key in figuring out what's going on. And then you want to keep your lips wrapped around there real tight and your teeth around it as you breathe in as well. You're going to feel like you're breathing out and nothing is coming out. You're supposed to keep doing that for 6 seconds, which is a long time to be breathing out after that sudden rush of air. And then when you breathe back in, it's going to take a while too, and that's okay. And they're going to let you know based on what they're seeing on the computer or on this screen when you're done. So that's a lot to go off. I mean, that's one of the reasons I'm talking about this with you, because it's kind of a complicated thing to do. I really like when I'm doing it to yell at my patients. I hope none of them have been offended, but to cheer them on, because it's a hard test and it's hard to remember what you're doing because you've never done this before and you're probably not going to do it that often either. So let's get going. I'll demonstrate for you, and then I think I'll coach you through one, and then I'll do one myself so you can see just how much I suffer with it too. Okay, so that's all blocked. Please check correct insertion. Okay. It's setting the baseline, so we need to avoid it going in through. Goes to show doctors don't always know how to set this up right. Oh, I bet that matters. There we go. I inserted it wrong. Sorry. Okay, then I block the flow with the plastic bag. There, now I've done it right. Setting the baseline. Okay, so the goal is you're going to blast out your air as fast as you can. Take a deep, deep, deep breath in, and then put this to your mouth, and then blast out the air. You want as much air going through in that first second. But then you have to keep some semblance of air. You got to keep trying to get air out for the next 6 seconds. It feels like forever. And then once you've gotten to that 6 seconds, the technician or doc will let you know, and then you'll start breathing in again. So we'll see how I can do this. So there you go. That's how the basics of how you do spirometry. It doesn't look very cool or sexy or anything that you would do on a regular basis, but that's the idea, blowing out as much air, and it's hard and it's a lot of air coming out at once, and then you feel like you've got nothing left and you're still supposed to keep going for some reason, and you go, 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 and then you get to take a deep breath in, keeping that good seal around the tube, and that tells us there's a certain ratio that I'm looking at, and that's a marker for whether you have an obstructive lung disease. And then I actually look at a specific other number that tells me how bad, how severe that obstruction is. One of the goals is not only to get it out 6 seconds, but I'm looking for 25 milliliters of air being released over 1 second. And you'll have to do this a couple times, not only because it takes a little while to learn, but because it's really the average of those 3 numbers that you're looking for to figure out what's really going on with your lungs, making sure that one number is not just a fluke. If you cough in the middle of it, which is a pretty common thing to do when you're trying to rush all this air out, we have to retake that one. That one doesn't count. The cough will mess things up. So hopefully this is helpful for as you're heading into getting your lung issues evaluated. In case there's any question, I realize this is called a spirometer or spirometry. If you've ever been in the hospital and had a little breathing tube to kind of make the numbers move and the dial, that's called an incentive spirometer. You're right, they are very similar terms, incentive spirometer and just plain old spirometer. So they're both just measuring how much air you're getting out. So if you caught that, good catch. They are similar. One is more to diagnose. This is spirometer is to diagnose, and that one is to encourage you to take deep breaths when you're in the hospital. It's easy if you're laying around or in pain and deep breaths hurt to not use those parts of your lungs. while you're in the hospital or recovering from something. And if lungs aren't being inflated and used, they tend to collapse a little bit and collect water and get pneumonia and allow bacteria or viruses to grow. So that's not good. So an easy way to prevent that, I mean easy, is to make sure that you're taking deep breaths at least once an hour, usually more often than that. And that incentive spirometer makes sure that you're getting the right amount of air out, and it's a little incentive. Look, I got the little ball up to where it's supposed to be. They have cool ones, especially in children's hospitals, things like that. Anyway, thank you so much for watching. Since asthma does tend to be associated with a lot of allergies, I've got some more allergy videos up here for you to watch. And if you wouldn't mind subscribing to my channel, I'd appreciate it. Thank you for watching.